All right, gonna scan the room. Okay. My name is Liz. I'm going to be doing a H2T assessment on my patient, Lauren. Alright, first thing I'm going to do is inspect the overall scan of the head, the face, and the neck. I'm looking at the color, temperature, turgor, texture, moisture, bruises, lesions, nevi, scarring. I'm going to go ahead and move on to the head and the scalp. I'm inspecting for symmetry, inspecting midline position. I'm inspecting the scalp for hair distribution, color, texture, looking for any tenderness, masses, nodules, any infestations or depressions. Alright, and moving on, going to palpate the temporal artery. And to palpate the lymph nodes, we've got preauricular, postauricular, tonsillar, submandibular, submental, anterior cervical, posterior cervical, occipital, we've got supraclavicular. Alright, then going to do cranial nerve 5, palpate the masseterial muscle for the clench, open, for the click, okay, and then palpate the TMJ joint for any crepitus or tenderness. Then going to move on to the eyes. I'm going to inspect the lashes, the eyebrows, the palpable fissures. Going to inspect the conjunctiva and the sclera for any redness, swelling, any drainage. Going to do cranial nerve 2. I'm going to inspect visual acuity. I'm going to have you close your right eye and read.
LTFPH.
Okay, close your other eye.
LTFPH.
Alright, and open both eyes.
LTFPH.
Okay, we've got 20/50. Alright, and then I'm going to inspect, consensual and direct, and then also the red reflex. Pupils constrict. No reflex. Red reflex present. Alright. Then I'm also going to check for extraocular motor extraocular cranial nerve 3, 4, and 6, and then also check for accommodation. Okay, so follow my finger. And follow in. All right, and then I'm going to check for peripheral vision. Tell me when you can see this.
No.
Okay.
No.
Okay. All right, and then going to move on to the ears. So I'm inspecting the outer ear appearance, the tragus and the pinnae for any masses or tenderness. And then I'm going to inspect the inner canal of the ear and the tympanic membrane. Okay, tympanic membrane clear. I'm going to do the Weber and the Renee. I'm going to assess for lateralization. I want you to tell me when you can, or which ear you hear this in.
Both.
Okay, gonna do the Renee test, gonna check for air conduction and bone conduction. Tell me when you can no longer hear this.
No. Yeah.
Okay, now I'm gonna do the whisper test. I want you to close your right ear and tell me what I whisper.
ABC.
Alright, you have the other ear.
1, 2, 3.
Okay. Alright, now I'm inspecting the nose, make sure it's symmetrical and midline. Gonna do cranial nerve 1 to assess for, make sure the smell is intact, and also I'm gonna check for patency in the nose, okay? The Cleveland nose.
Mm-hmm.
Okay, all right. Then I'm moving on to the mouth. So for the mouth, I'm inspecting the oral mucosa, inspecting the lips, the teeth, the tongue, the posterior pharynx, the tonsils, inspecting the uvula and the floor of the tongue. Think open your mouth. Say ah. All right. Soft uvula rise with phonation is cranial nerve 9 and 10. Okay, stick your tongue out, move from side to side. Cranial nerve 12, tongue moves without gesticulations. Then I'm going to palpate the frontal and the maxillary sinus for any tenderness. All right, then I'm going to move on to the neck. So the neck, I'm inspecting for midline and symmetrical position. And then I'm going to check going forward for me. I'm gonna assess the thyroid. Okay. Okay. All right. Then I'm going to move on to the posterior chest. So for the posterior chest, I'm looking at the overall skin appearance, the color, texture, turgor, temperature, moisture, bruises, lesions, nevi, scarring. I'm looking for any signs and symptoms of respiratory stress, such as dyspnea, crepitus, cyanosis, any nasal flaring, retraction, any tripoding. Right, so I'm going to check for chest expansion. Take a deep breath in. Okay, and tactile premises, say 99.
99.
Okay, and then I'm going to percuss for any resonance, dullness. All right, and then I'm going to listen to your lungs. All right, and then we're going to do whisper, pectoralic, agrophony, and bronchophony. All right, say whisper 1, 2, 3. All right, say E.
E. E. E. E. E. E. E. E.
All right, and say 99.
99. 99. 99. 99. 99. 99.
Okay. Then I'm going to go ahead and check for CVA tenderness. Tell me if it's hurt. Okay. All right. Then I'm going to have you turn around and do the anterior chest. I'm looking for any signs and symptoms of respiratory stress, any dyspnea, any cyanosis, nasal flaring, any retractions. I'm checking for symmetrical chest expansion. Okay, and then do tactile premises, like 99.
99. 99. 99.
Okay, and then I'm going to percuss. All right, and then I'm going to auscultate. to move on to the cardiac. We're gonna listen to the 5 points. The aortic, pulmonic, herbs, tricuspid, and mitral with the diaphragm and then the bell. We've got aortic, second intercostal space, right sternal border. Pulmonic, second intercostal space, left sternal border. Herbs, we've got third intercostal space, left sternal border. Got tricuspid, fourth intercostal space, left sternal border. And then mitral, we've got fifth intercostal space, midclavicular line. Do the same thing with the bell, the aortic, pulmonic, herbs, tricuspid, mitral. And then going to palpate for the PMI, and then auscultate for a minute, listening for the irregular rate and rhythm for a full minute. And then we're gonna recline back. I'm gonna do the same thing while she is supine. I'm gonna listen to the 5 points again with the diaphragm and the bell. We got aortic, pulmonic, herbs, tricuspid, then mitral, the bell, aortic, pulmonic, herbs, tricuspid, and mitral. And then I'm going to palpate cardiac pulse, and then listen for any bruit. And then turn your head from side to side, looking for any jugular vein distension. Right. Now moving on to the abdomen, inspecting the overall skin appearance, looking at the color, temperature, moisture, texture, turgor, any bruises, lesions, nevi, or scarring. Also looking at the contour of the abdomen, looking for any visible pulsation. Going to auscultate the renal, aortic, iliac, and femoral artery spring bruit. Got aortic, renal, iliac, and then femoral. Okay, and then I'm going to auscultate the abdomen for bowel sound. Okay, then I'm going to percuss abdomen, looking for any dullness, timpani, flatness. Then we're going to do light palpation, checking for any tenderness, and then deep palpation. All right, and then that's going to check the liver and spleen. All right, take a deep breath in. Okay, checking for spleen, and then, liver and then the spleen. All right, spleen, not palpable, liver, palpable. All right, then I'm gonna have you sit up. All right, moving on to musculoskeletal, inspecting and palpating the joints of the fingers, the wrist, the elbows, and the shoulder on both, inspecting for the color, looking for any tenderness, redness, swelling, nodules, deformities, symmetry, and any crepitus. All right, I'm gonna squeeze my fingers, checking for strength, 5 out of 5 strength. Gonna do range of motion of the fingers. So I want you to flex, extend, hyperextend, and adduction, abduction, adduction, thumb opposition. All right, for the range of motion for the wrist, we're going to do flexion, extension, hyperextension, ulnar deviation, radial deviation, and rotation. All right, I'm going to assess cap refill of your fingers and do check radial pulses. All right, and then I'm gonna move on to the elbow. We're gonna do flexion, extension, hyperextension, and gonna do strength of the elbows. Push and pull. All right, then the shoulders, we're gonna do range of motion of shoulders. We're gonna do flexion, extension, hyperextension, internal rotation, external rotation, and abduction, adduction, and circumduction. And then I'm going to do cranial nerve 11, which is shoulder shoulders. Okay, and then I'm going to do strength for the shoulders. Push, pull. Okay. All right, then moving on to the lower extremities. So for the lower extremities, going to assess the overall color, appearance, looking for any edema. I'm going to assess the pedal pulses and tibial pulse in both legs. Assess cat refill. All right, for the toes, range of motion, we're going to do flexion, extension, hyperextension, and then adduction, adduction. And then for the ankle, we're going to do plantar flexion, dorsiflex. Now I'm going to check the strength. So plantar flex, and then dorsiflex. Okay. All right. For the knees, we're going to do flexion, extension. And I'm going to test strength on it. All right. Push and then pull. That I strengthen that. And then I'm going to go ahead and do strength of your hips. I'm going to do, okay, push. Ooh, okay, all right. And then I'm going to go ahead and assess deep tendon reflexes. All right, got brachioradialis, got bicep, and then tricep. I'm going to do the side. Got brachioradialis, bicep, and then tricep. We got patellar, and then Achilles, and then Levinsky. Okay, all right. And then we can do the vacatory sensation of the proximal ulnar and the medial malleolar. Okay. All right. Now I'm going to have you stand. We're going to do range of motion for the hip. Going to do flexion, extension, hyperextension, and then we're going to do abduction, internal rotation, external rotation, circumduction. And do that with the other side. External, flexion, abduction, adduction, then internal, external, and then circumduction. Okay? And then we're going to do your spine. So we're going to flex forward, and I'm going to check the spine for any curvature. All right, flexion, okay, extension, then hyperextension, lateral bending, and then rotation. All right, now we'll face forward. We're going to do the cervical climb, flexion, extension, hyperextension, rotation, circumduction. Okay, and then we're going to, I'm going to have you walk regular and then tandem walk back with one foot in front of the other. Okay, and then hop on one foot. Okay, and then I want you to close your eyes and assess your gait with the lumbar. Assess your balance. Okay, all right, I'm gonna let you have a seat. I'm gonna do the finger opposition. Touch your finger, touch your nose. And then finger opposition. And then, alright, I'm gonna do steriginosis and glyphosation. I'm gonna place something in your hand. I want you to tell me what it is. Close your eyes.
Paperclip.
Okay.
Q-tip.
Okay. And then I'm gonna trace something in your hand. I want you to tell me what it is, okay?
A. 1.
Okay. Then I'm gonna do, you can open your eyes. I'm gonna do cranial nerve 7. I want you to close your eyes. Raise your eyebrows. Smile. Frown. Puff out your cheeks. And pucker your lips. And then I want you to tell me where I touch, okay?
Forehead. Chin. Arm. Leg.
Okay. Alright. I think this concludes the